Assalamu alaikum wa rahmatullahi wa barakatuh. Thanks, Dr. Muhammad. Thanks, Dr. Ahna. So I'll be quickly presenting this paper on the determinants of the low back pain among the healthcare workers. Why did we choose this topic or this study? Actually, we noticed in the clinic that we are seeing more and more colleagues from all disciplines in the healthcare, whether nurses, physicians, dentists, and paramedics in our clinic. So there is nothing really to disclose about this study. The purpose was to see what kind of risk factors are important for this group of the patients and why they are presenting with low back pain. Is it like the rest of the general population or what's happening? So we did a cross-sectional study using self-administered questionnaire and we included Ronald Morris disability score to see also the impact of such complaint and such problem on these patients or on this group. We distributed it to almost 800 individuals, including primary, secondary, and tertiary care services, and we looked to so many data, including the demographics, the work condition, and history of chronic diseases, regular exercises, and etc. And then we ran univariate and multivariate analysis to look into this. So we had good response rate, about more than 90% or close to 90%. 740 participants replied, and they reported prevalence of low back pain in the last 12 months around 73% or 74, you could say. And the reason we chose the last 12 months just to avoid any recall bias when reporting the problem. And the neurological symptoms reached up to 50%, the association other than the back pain. And the people who really had medications and went for physiotherapy sessions, they were about 40%. And the people who went to the clinic and attended clinics for this purpose, whether neurosurgery or orthopedic clinics, they were about 20%. That means about 80% they were treating themselves without any medical consultation. So the overall prevalence, as you could see, this table is representing what I have just mentioned. And on the univariate analysis, some interesting things that actually people in primary health care, the secondary and tertiary care, they are more prone to have this disease or to have this complaint in general. There is also significant association with the age for the group that's between 30 to 20. Interestingly, we found surprisingly as well that lots of healthcare workers are not practicing any kind of sport. You could see there the number, 513 out of 700, they are not practicing any physical exercise. And this was associated with higher impact of the disease. Previous traumas or exertional back traumas is also significant. And another factor, which is the sitting, long sitting, and we thought this is for the dentist, they have it more than anybody else, and they were included here in our study, and they were about 8% of our study participants, they were dentists. For the multivariate, we ended up finding a few variables that were significant in this study. One of them is the BMI, and surprisingly as well that almost 60% they are either overweight or obese. And then the history of previous back traumas, whether work-related or any other traumas, is also significantly associated with this complaint, and the lack of physical activity, which is a bit shameful that the majority of healthcare practitioners are not practicing any physical sport. This is a quick look to the Ronald Morris disability score, and you find among the most of the scores that there is a major impact. The worst is actually on the daily activity and even like getting to bed and not having enough sleep time due to this impact or due to this problem. So our conclusion that from this study, that many preventable risk factors have to be considered, like the BMI, the lack of regular exercises, and we kind of escalated this and we sent it to the Directory of Ministry of Health in our region to improve actually the work environment by having changing the work times at least, or have rest time for the healthcare workers, and to have areas where they can relax, and also to have, if possible, to have gym inside the work or actually at work place. So this is the conclusion of the study, and thanks for listening.